All right, so Jing, what are the last 4 digits of the phone number that you're calling in from?
3331.
Okay. I don't see you on the list of call-in listeners. If you're able to call in through just the numbers that were listed on the agenda, I can see you on the attendees, and then I'll transfer you into the main meeting so that you'll be able to talk at any time.
Okay, so Francisco, what are you grateful for today?
What am I grateful for today? I'm grateful to see all of your lovely faces. I'm so glad that I was able to help make this meeting happen. It's so great. I mean, it's very different, obviously, virtual meetings in the age of COVID, but I'm really happy that you're all here and that we could make this happen. It's been eons since I last saw you all, since before Carley had her baby.
And here we are. And Dakota, what are you grateful for today?
Probably my family and my animals. They're getting me through this time.
Wonderful. I see your picture with you and your dogs.
Yeah,
Okay.
those are my children.
Oh, did I miss anybody? I don't want to miss anybody. Wonderful. So our question for today to share is we've been self-sequestered. We've been practicing physical distancing. We've been washing our hands. We've been wearing our masks. Those are choices, healthy choices and safe choices that we're making. And how has this been for you? What have you learned? What have you missed? Who would like to start? Because I will call on somebody. Sophie.
Here, oh, sorry, never mind.
No, go.
Okay, I have learned
1 to 2 minutes of sharing, so everybody has a turn.
Oh, yes, no problem.
Okay.
I've learned that being able to shelter in place with family and kids is a lot more rewarding than I thought it would be. I've learned that it can be fun to be stuck. I mean, it just hasn't, I expected it to be so much more harder for our family than it is. So I've learned that the well inside of, I guess, conforming to a pandemic is not as hard as I thought. Sorry, I just jumped in to say something to get the ball rolling. I didn't have anything already thought out.
Well, that's okay. Let's be spontaneous. How about you, Kera? What have you, what did I do here? How has this piece of our lives been impacting you?
Yeah, so yeah, I'm kind of with Sky. I learned that there's so much joy in the small moments and the little things, and I've learned how creative my family and loved ones can be, and yeah, I think there's just so much beauty that was overlooked previously, but now you really come to appreciate it and not take things for granted.
Okay, how about you, Hillary? Unmute.
Muting. What I've learned is, well, I'm very accommodating and resourceful, and so trying to figure things out and how to do things and what to do and how to make it happen, and you know, all of that. So I've learned that. I've learned that I really like this more relaxed pace instead of running around all over the place and visiting people. You know, just having Zoom conferences or talking to clients on the phone is so much nicer than driving. I don't miss driving. I don't miss being in traffic. God. Oh, you know, like leaving Portland at, you know, 4:30 or something. Ugh. So I don't miss any of that at all. I like that. And what have I learned? Oh, I've learned that we have a great opportunity for a reset in this country, and that we have a great opportunity to rethink about how we're doing things and to really talk and listen with people about what we want and how we want to do this, and not take things for granted, and not take things for granted. So we have that opportunity, and I think that's an important thing that people are learning, that we can make a difference and we can shape our world in that way.
Yeah.
That's my soapbox. I'll get off now.
That's okay. We all have our soapboxes. How about you, Suzanne? How's this experience been for you? What have you learned? What have you missed?
I miss the freedom of doing basically, not feeling like you have to gather up a whole bunch of stuff before you go to the store and that sort of thing. But and that kind of freedom. But what I have learned, which unfortunately was a big shock to me, was how badly our public health services have been funded and how much different we could have made them had we stuck to it and had the right people. And because I'm still doing nursing and because I still love it, that's what I've learned.
Important thing, help in the next election, eh?
Yes.
How about you, Laura? Just remember, good.
Okay. Well, it's been stressful. It's been difficult. Mainly because, well, my job, I traveled a lot. I met face to face with people, and I would come home exhausted before, because I was always, when you're marketing, you're on stage, you're always on. So I would come home and I would just like kind of decompress, and this was my oasis. But I am finding that I miss people. I miss human people, like touching. Yeah, I mean, this is great to see everybody's face, but I can't tell you the last time I hugged a stranger, like a stranger, like not family, you know what I mean? Mm-hmm. And so that has been a lot harder than I thought. The effort it takes to watch for facial cues and body language in a Zoom is very draining. And there for a while, I was doing 3 to 5 Zooms a day. This room that I sit in, I basically get out of this, my bedroom. Welcome to my room. And I'm only out of this room maybe 4 hours a day. Mm-hmm. And so that part has been difficult, and I'm desperately in need of a vacation, but I'm also not willing to go away yet. I'm not comfortable there. As far as the caregiving stuff goes, David's vision has taken another turn for the worse, and so I'm taking on some more responsibilities with that. And then my younger brother is in Arizona in a hot spot, and he is currently in isolation. So it has just been a mixed bag. It's like, in a normal illness, I would have jumped on a plane to go be with him and his wife, but I can't do anything there, so there's no point in going. You know what I'm saying? So it's been a real mixed bag, and I need a break. Yeah. I appreciate that I've had employment. I appreciate that I've had a job, and I have great people that I work for, and but I'm ready for a break.
Hear ya. Thank you. Basil, what have you learned? What have you missed?
I've learned about like the full extent of the impact that technology can have on our lives. I really thought that the stay-at-home orders was gonna like shut down a lot of things and a lot of opportunities that I had, but I was able to get internships, and I'm working remote right now, and I found that kind of interesting how within a span of a few months, a lot of our work life has resumed. And it's working at a pretty good efficiency. I've missed in-person communication with friends, and really like having the interaction with people. That's been a big downside of the stay-at-home orders. But again, with technology, I'm still able to keep in touch with all my friends over FaceTime, and I just found that interesting.
Thank you. How about you, Mark? What have you learned? What have you missed?
Well, let's see. Well, there's certainly been a lot of learning. For those who don't know, my wife is the chair of the Washington County Board of Commissioners, and the Washington County Health Department reports to the county administrator, who reports to the board. So pretty much every week they get updates from the county health administration about the status of COVID in there. And some of that comes home, and I get to hear some of those stories, and a lot of it's done in public, and I can tune in if I want to. But we also have plenty of information being pumped at us from the city about impacts to businesses, impacts to residents, policy matters that we need to think about. So there's a lot of change in the materials that we think about and read and consider right now. But in terms of getting work done, frankly, the city council does pretty well operating through these electronic means. We haven't had much challenge with that. And I chair 3 other committees associated in various ways with the city, and all of those meetings have been run through either Zoom or Microsoft Teams, and those seem to be going okay too. Personally, I as a city councilor, I don't spend a lot of time at City Hall anyway, other than when we have meetings such as this meeting or the city council meeting. So my work life is not terribly different than it was before. And the things that I do at home are unaffected by that. So I think the main thing that has affected me is just not going out and having coffee with people or going out to restaurants routinely. We did go out to a restaurant this past weekend, carefully. It was an outdoor seating situation, which is nice. But it's for me personally, it's not a huge change, but I'm also aware of how many people are directly affected. And so we're trying to be really mindful of that as we develop programs and policies to help people out.
Yeah, thank you. Sophie, what have you learned? What have you missed?
Learned how to wash my hands. Trying to break the ice here. I also learned something more serious, how to live in fear, because there were so many people putting so much fear in my heart, and I didn't need it. And so I've learned to combat that and really understand that living in fear is not a thing. I'm also missing my relatives in Canada. They live in Saskatchewan and several other provinces over there. And so we can't go visit. And so this is the summertime when we typically would go visit them, say hello. So that's been interesting. And I also learned that there are a lot of people in this world that already live in kind of isolation or quarantine for various reasons. Maybe they have an autoimmune disorder. Maybe they are amputee or something like that. So they don't go out as much or what have you. So it really made me just be really grateful for my health. And I miss hugging. Not random strangers. I don't do that. But a lot of my industry, it's very personal, and I deal with very stressful situations. Families cry with me very consistently. It's a big decision for what they're doing. So being able to hug somebody, I'm not even meeting in person at all. So yeah, but it's all good.
Thank you. Lou, how about you? What have you learned? What do you miss?
I'm gonna glomp onto what Kara said right at the outset. That really struck a nerve that I think I took things for granted, and especially just the most essential thing, food. I took the ability to go get food and have fresh vegetables and meat and eat healthy and eat what I want. I took that totally for granted. You could just pop into a store. So, so that, I don't think I'll ever get over that again. I mean, I'm just grateful for every meal I have. I'm just so happy that we can get food in here. We can do it safely. That we have the means and the technology to do, I use Walmart now. I do the pickup outside. I don't have to go in stores and expose myself. So there's that. Also, I'm probably happier than I should be. I'm kind of like what Hillary said. I felt I had to do things all the time. I had to be busy. I had to run around, and now there's an excuse to kind of lay back and read a book and kind of cool my jets. We just feel life is less stressful in some ways. It's more stressful in some ways than less stressful. The other thing is it's like been weirdly growth period for me. I'm doing things I embarrassingly have never done before. I used to dry clean everything. And I don't go to the dry cleaner. So now I'm ironing my shirt. I've never ironed a shirt before this. It's embarrassing. So I'm ironing my shirts. I'm flossing my teeth because I'm not going to the dentist. I'm cutting my own hair. I bought a razor, so no more haircuts. So I'm doing my own haircuts. Oh, I wrote down, oh, toilets. I'm cleaning toilets. Never cleaned a toilet in my life. So I'm now the toilet cleaner, you know? So I'm you know, it's a growth thing.
Thank you. Carley, how about you? What have you learned? What do you miss?
I mean, obviously you all know that this has been the last few months have been a tremendous amount of change for me personally. Having a baby during this was, you know, I mean, that was quite the experience. I mean, I didn't even know for sure if Mark was going to be able to be there with me. He was, but you know, there was a lot of uncertainty and fear around what that was going to look like. You know, the doula couldn't come into the hospital. You know, we had to get a COVID test when I was there just to make sure before I didn't have to wear a mask while I was having a baby. So that was good. But you know, so this has been, I mean, honestly, it's having a baby in itself causes a lot of anxiety, like having a newborn around. If any of you some of you haven't gone through that experience, but you know, it's nerve-wracking to have a newborn and have a 3-year-old, right? So it's been trying, and there's been a lot of the anxiety collectively from the combination of having a baby and then also just this fear and stress over like what could happen. And it doesn't help now that you know, now Addie's back in daycare. We put her back in daycare last week because both my husband and I are working from home, and having a newborn and a 3-year-old at home and trying to work full time is just not something that is it's not something that's really possible. I mean, I suppose it's technically possible, but she would end up being on in front of a tablet for most of the day. So it's hard. That's the hard thing. That's the thing that I miss, is the not being able to just kind of feel comfortable with her going there, because it feels like we're exposed in a way that it's hard to live with. And at the same time, there's all these beautiful emotions and experiences that have come from it. You know, the things I've really appreciated and learned of getting to know our neighbors and have our neighborhood walks and to just really slow down. And my mom was able to come up for 7 weeks before and then right after I had the baby. And that was wonderful because that's a rare thing in our lives. So, you know, it's this huge mix of emotions that have happened for me for the last few months, and it's still going on, right? Because we're still in it, but you know, it's my kind of mixed. It's just a mixed bag, and have been fortunate that I do know several people who in different places, a couple here and a couple of other places, who've been sick, who caught COVID. You know, and thankfully everybody's been okay, but okay, one's still having ongoing issues, neurological issues. So, you know, it doesn't feel that far from the reality. Does feel close by knowing people personally. So I think that I'm not alone in that. I think a lot of people are experiencing that this feels very close and real. So that's where I'm at.
Thank you. Hayden, how about you?
Yeah, hi. I'm one of the interns working with Kera at Washington County. And I had a really unique experience when all of this went down in I guess when it really started to escalate in mid-March. I was actually in Scotland completing one of my internships, you could say, as an occupational therapy student. And it was really interesting seeing how they addressed everything, you know, the crisis there. And then flying home was definitely an experience I do not want to ever repeat again, just, you know, fear of the unknown. And so that was something that was a learning experience. And then since then, I've definitely learned that being in prolonged relative isolation is not good for my mental health. And I've learned ways that I've been able to cope with that, but it's definitely been a learning experience for me personally. And I'm getting better at cooking, because what else is there to look forward to in the day except a good meal, right? So that's what I've learned.
Yeah. Jing, how about you? What did you
Hi, can you hear me now?
We can hear you.
Oh, great. Yes, finally we're connected. Yes, I'm so happy to see everyone, to see your smile and hear your voice. And it has been hard time for everyone. And as a healthcare worker, I have been almost working every day as usual, but life and work have definitely been changed a lot. And I learned that the entire world is much closely connected than we realized before, whether it's between among countries or among different states or among different counties. We are affecting each other. And so therefore we need to support each other and work together, especially during this challenging and difficult time. And I was touched by some kindness, supportive attitude among co-workers. For example, when we were requested to reduce minimal staffing, and I thought initially it's very hard decision, but our colleagues arranged it well and very considerate to each other, make the job much easier. So that make me feel very grateful that I work with such a group of nice people in the hospital. And also when we have food basket, food to be delivered to work to save people time go shopping, some people volunteered to donate food basket to people who are in more need. That's also action that may help people feel better about the world and about people around us. And during this difficult time, I realized the impact on everyone, especially on the elderly and children. Because of the impact on elderly, I feel that the work of our committee here is more important than before the COVID-19 outbreak. And we need to provide more support to the elderly people. And for the children, because I have children school age, one in high school, one in college, their study have been heavily affected, and they miss the time with their friends. They miss interacting with teachers and the students in the classroom. And I feel sad for them because a few months or 1 or 2 years is so critical in for the students' study life. So I don't know what will happen in the future. I just hope the things will be smoother for every student in the country. And also, I I'm not sure how long this situation will last, but I think it's important to be optimistic and to be adaptive and to be creative too, to find ways that we can still realize our goals in life and to do things relatively well.
Thank you.
Okay, thank you.
How about you? What have you learned? What have you missed?
I learned that I learned many new habits in the beginning. Yeah, in the beginning, wearing mask is difficult, but now I'm very used to it now.
Good.
And
thank you.
Yeah, I miss.
I'm going to move on to Dakota so we have time for everybody.
Yeah. Okay, thank you.
Thank you. Dakota, are you there?
Yeah, I'm here.
What have you learned and what have you missed?
Well, I've missed seeing people in person. It's been weird doing everything virtually when normally I'm more hands-on with the people I work with. And something I've learned is new ways to connect with people since we're doing all this physical distancing. I've gotten to know a lot of my neighbors, either through waving at them or just yelling across the street. And so it's been nice learning new ways to connect with others.
Thank you. Hi, John. Welcome. We're sharing what we've learned and what we've missed during this historic time we're living in right now.
Yeah, well, as a retired guy, I wasn't going to work anyway. I kind of miss the in-person meetings that we have here and going to church and things like that. We've been going to church virtually on Sundays, which is a little bit different. We go out on walks quite a bit, and I've been doing some bicycle riding and photography, and that's occupied me pretty well. I'm also, as some of you know, a retired industrial hygienist, and I'm doing some volunteer work with the American Industrial Hygiene Association and their ad hoc team on COVID-19.
Wonderful. Thank you. I know we've run across each other on the trail, you and your wife.
Yes, yes.
So it's thank you all for sharing. And what I'd like you to think about is how have you shown yourself self-kindness and appreciation for all that you do for yourself and others? It's very important, regardless of what you do, where you are. Everything you do to take care of yourself is key in all of this. So thank you all for sharing. And now we're going to move on to Kera, our awesome Washington County specialist, who's going to share with us about what is going on with Washington County for resources and what we can plug into. So welcome, Kera.
Hi there. Thank you, everyone. Let's see, can you see my screen okay? Mental health matters.
Yes, Kara, would you mind tipping your computer just a little bit so we can see your face?
Sure.
Thanks. There, perfect. That was fine. It's just like not seeing your chin. But now
I know it's a habit. My mic is here, and I always feel like I need to get real close, but I don't think I do. So, okay, here we go. So I'm just going to give you an update from Washington County Disability, Aging, and Veterans Services and go through some resources. Some are new and have just come online, but really all of the services and supports that Dave's Disability, Aging, Veterans Services offered before COVID, we are still doing. So we are still offering information and referral, family caregiver support, respite. We have in-home care opportunities for people. We are doing some home repair. So basically what the County Aging Services does is our aim is to help people age in place and be successful and independent in the way that they want to be and that makes sense for them. So we are a really great resource for all of the county to be able to utilize. If you're not familiar with Dave's, we provide support and services for people usually about age 60 and over. That's our funding is from the Older Americans Act, or if somebody is living with a disability. And disability can be a physical disability, or it could even be cognitive disability as well. So we provide services for that. So I have it's probably a little hard to see. How about there? We have this 855 number is our main number. You can call us at any time to get more information on anything that I'm going to talk about today. That's really the one-stop shop to get more information and support. So a few other things, we've definitely had a heightened focus on loneliness and isolation, which was a big part of my job before COVID. We were well positioned and had some support waiting in the wings and some projects that we were able to launch in the past couple of months to provide even more support to people that are experiencing isolation. So just a few support options is, if you haven't heard of it yet, the Senior Loneliness Line. A couple months ago, this was picked up by OHA and has been funded through the end of the year and is now statewide officially. So the Senior Loneliness Line is a 24/7 line staffed by trained volunteers to talk to people who are experiencing isolation, who need a little support, just someone to talk to at any time, day or night. So that is open and ready. We also, in Washington County, we have a very unique service that's available, Oregon Senior Peer Outreach. The county funds this community partner to provide free peer connection to older adults in Washington County. And what they do is that they actually staff older adults, so they're employed and trained as mental health peer support specialists. So they're kind of like a lay mental health, like community-based professional that provides peer support to other older adults in the county. So it's a matching service. So if anyone in our community calls or is referred, you would be matched with another older adult that's trained, and they would call you on a schedule once weekly. So it is an ongoing relationship for as long as you need it. There's no cutoff point. It's a little bit different from the loneliness line. This line is where you call in, if you have to make the call in, but the Oregon Senior Peer Outreach phone-based support is you're actually matched with a peer counselor and they call you on a schedule every single week. And they've actually been doing some really great work with Grand Pads. It's a tablet that's a very user-friendly tablet that is easy to set up, easy to use. And so a lot of the people that they work with in the county, they actually provide them with the hardware to be able to make their calls to their peer counselor using a Grand Pad, a tablet. So it's a face-to-face call. And that person can also reach out to their family or friends or doctors or whoever using that same tablet. And you don't even need internet to use it. It's a cell phone based tool. So this is a great service for people in the county who haven't been able to connect via Zoom or virtual programs. Great to get them set up so that we can start building the capacity to be able to do those kinds of things. Let's see, we have, I've got the ADRC on there again. This I want to make sure that everyone is aware of. Washington County has now opened the door to provide free counseling, pandemic-related counseling, to any Washington County adult through the duration of the pandemic. So I just think this is so important. I actually was just talking to a neighbor the other day who was struggling a bit. This is for any adult in Washington County, and it's what it is. We say that it's pandemic related. So if you are feeling depressed or lonely or isolated or anxious, and it is all related to COVID-19, if it is, at all related, then you would be eligible to take advantage of this counseling. So they usually get back pretty quickly. If you call that number, you can either make a referral for someone or you can call for yourself. And they usually get back within a day or two, and they'll get you set up with a partner, one of our community partners or mental health providers, to get a counselor. So it's not long-term, it's not forever, but it's definitely for now. And I hope that some people can take advantage of this. It's free. And when I say free, I mean your taxes pay for it. So thank you very much, and I hope you utilize that. We also have our crisis line, which is important to have handy. I actually gave this out to someone just the other day, again, a neighbor. So anybody that is experiencing a mental health crisis that needs support right now, this is the number to call. So if somebody's in a state of really a lot of emotional distress, or they're just, feeling like I can't take one more day of this kind of talk, or say, I don't want to wake up anymore. That kind of talk is really, we want to be paying attention to when we hear that, so that we can get people support pretty immediately. And then we have NAMI of Washington County does support groups online. So there's lots of different types of support groups for lots of different types of people available through NAMI. And I have and I'll send this out, Carley, to you, so you can, everyone doesn't have to feel like they're taking notes or anything. We have some other resources that are available and still continuing. We have some classes that we're doing. And I think that's it for me. Oh, I have some tips here. This is great for everyone. Just tips for yourself or for people that you're interacting with on just how to maintain some routine and some normalcy, and trying to keep good spirits and building that resilience as much as we can while we're remaining in isolation. So there's a few things with a few more resources. I like this one, turn off the news. I have to take that advice myself when I feel myself getting worked up. And then I have some more information on crisis support. So if someone you feel like someone, your gut's telling you that someone's really struggling, this kind of gives you a step-by-step kind of a choose your own adventure of what to do when. So these are things that I will send, and you can go through, and hopefully you can use them. Does anybody, I'm going to stop my screen. I'll send this to Carley. Does anybody have any questions for me?
Yeah, this is John. Has this been communicated to some of the pastors and people like Father Jeff at St. Bart's Episcopal Church, people like that?
Thanks for asking that question. We have been out running around with all of our senior centers to make sure that they have this information. We've been meeting with long-term care facilities, case managers, social workers. I have not had a really strong relationship with our faith communities and would love to work on that. So I feel free to send this out and forward it to whoever you think might be interested, but also my information's on there. I am more than willing and so happy to come and meet with faith communities, church committees, whoever, to go through this information and answer any questions that they might have. So, and this is how we do it. So thanks for thinking of that. If you'd like to send a recommendation or just forward this on, I really appreciate it.
Hey, Kara, could you send it to me and I'll put it in the minutes?
Yes.
Good. Thank you.
Okay, the reason I asked is because Father Jeff has been saying that he's been getting some inquiries.
Okay, yeah, and probably a lot of us have. So this is such a great time. Yeah, I would love to do some one-on-one with folks if they have questions, and maybe even do a little bit of a deeper dive into some support and some classes and training. We have our older adult suicide prevention training and crisis support training available online. So we can do those things online with anybody that's interested and able to do that.
Any other questions for Kera?
Kara, thank you for sharing that. It's really great to sort of see and can get a recap of what's going on in Washington County. I'm kind of wondering, with all of the things that you are doing, and are you seeing where are the gaps right now in terms of the needs you're seeing that's not happening yet, or not being happening as well as you'd like, particularly in regards to something that the BCI might want to be aware of as a gap, right? I'm sure there's lots of gaps in general, but like, yeah, specifically what would be relevant for the BCI to know that there's some sort of need?
Well, I think that what I'll probably have to say won't be anything groundbreaking to anybody in this group, but I've noticed that the older adults in our community are entirely resilient and so creative and so willing to make shifts in how we do things, just like everyone else in the community really has been. Everybody's stepped up, everybody's helping each other out. But there are a lot of older adults out there that still don't have technology. Then that might mean having the hardware, having access. So pretty much all of the barriers that we dealt with before COVID are still there. Language barriers for people in our community are still there. So we are trying to work with some grant funding to get people internet access, to get them hardware like iPads and the grandpads, and even sometimes just phones or phone service for people. So I think that's something to keep in mind, is that a lot of people are showing up and they're doing the virtual thing, and as much screen fatigue as we're all probably feeling right now, there's still a lot of people out in our community that don't even have that. So I think that's what we've been really trying to be present with, and try to figure out in the world of aging services in the county, and see if we can narrow the gap on that a little bit. So technology and technology support, and yeah, and get people connected in that way.
Thank you.
Carley, I'm sorry, can I ask a quick clarifying question? I thought I heard you reference BCI. Did I hear that right? And what's BCI?
I just was saying BCOA.
Oh, okay. I just heard it wrong.
I meant BCOA. Yeah,
okay.
I might have. I also noticed that Sunita popped in, so I just wanted to say hi, since we didn't say hi when we were talking then. So welcome.
Yes, welcome, Sunita. So any other questions for Kera?
Kera, this is Jim. Is there a program to help the elderly get some shopping delivered? Is there an organization recruit volunteer to do that?
Yes, so the question is shopping delivery, grocery delivery, supplies, things like that. So I would probably direct you again to use the ADRC, the main number, and that was the best way to get connected to local resources. Meals on Wheels is covering a lot of that work now, but there's been a lot of more patchwork of organizations. Some of our senior centers have been filling that need, sometimes just neighbors or church groups. So there's a whole patchwork network of organizations and individuals that are helping to fill that need. So anybody that needs food assistance or supplies, call the ADRC number and we'll help get connected to local resources.
So let me ask a follow-up question here. Is there somebody who's tracking the patchwork of is ADRC dragging that? So like, as let's say that Basil had mentioned something about some high schoolers or some younger people who are interested in maybe helping to support some efforts, is if they wanted to be helping to support some sort of effort, you know, not the person who needs it, but if they wanted to help, you know, provide.
So the ADRC database is populated by individuals and organizations that have the resources and things like that. So so just call that ADRC number. If you have a service to provide, then let us know, because that's the only way we'll know about it, and we'll populate it. So we'll put it into our database where people can search for it online, or we'll just, I did it this morning. I had a church group saying, hey, we can go around to seniors' homes in Aloha and like help mow the grass and things like that. So yeah, all of that stuff, you can send it to me directly and I can forward it on, or you can call our ADRC and they can keep track of those resources, because everything's changing, right? It's a moving target. So we also appreciate if you're not doing those resources anymore, then you let us know so we can make sure everything's updated as possible.
Great. Thank you so much, Kara, for being with us and sharing us and sending that information to Carley, who will get it out to us. Really appreciate it.
Yeah, thank you everyone for everything you do. I might have to jump off for another meeting, but but Hayden and Dakota are here, and if we're ready, they had just something that they've been working on that we wanted to share with your group. Switching gears a little bit.
Okay.
Kara?
Yes.
Would you be willing to share your contact information in there for us?
Yes. I'll put it in the chat box right now, but it'll also be on the document that I'm sharing with Carley.
So I'm understanding that Dakota and Hayden are going to share something right now, Kara?
Yep. Are Dakota and Hayden, are you
Yep,
ready
we're here.
to share your screen? Okay.
Yeah, so in the course of our internship with Washington County, we've created some infographics, and so we just wanted to present to you one of them that we created, and we would love to get any type of feedback or anything you notice that could be improved for this particular infographic. So this one is on ageism. We've done a range of topics from ageism to loneliness and isolation to sexual health. And so this is just the one we were hoping to get feedback on today.
Hayden, what were you hoping that we were going to do? I'm a little...
So essentially, if you would just look at it and look at the wording, if that could be improved in any way, or if that you feel like there's something that could, I mean, granted, this is a rack card type of thing, so it can't be that extensive, but if there's anything that could be improved or reworded or anything you notice that either is good, just so we can get some feedback and get some eyes on it that are more than just the people who created it, because we can get blind to certain things.
Hayden, this is Lou. Hi.
Hi.
Would it be possible? It's a little hard to do that right now. I think can we get this sent out to us so we can view it? Then we can send the feedback. I don't know how we want to do that, but I would like to have some time to review it. I'm very interested in ageism. I've done some presentations myself. For my work, I've got a whole presentation I've done. So I'm very interested in what you have, but it's going to be hard to kind of go through this right now without a little time to review it.
Sure. Kara, do you have a copy of this, or Kara, can I send this to you and you can send it to everyone in this meeting?
Yeah, I'll send it to Carley, and that would be great. And just a little context. So this is part of Health Information Campaign with Washington County. So this is going to be available at some point to the community. So you are getting first eyes on it before it gets to the community. And that's why we're requesting your feedback and input to make sure that we're getting it right before it reaches the community. So that's what this is for.
Kara, and Hayden, where are you planning on putting this? You said it was a rack card, so you're looking at a little card like this wide.
I believe that there's two different sizes. I think the one I was thinking of was 5 by 8, I believe. So half a sheet of paper, almost.
Wonderful.
Okay. Just a quick comment about glancing at it. can you scroll up so you can see the beginning part with the title "An Individual"? Yeah, examples, an individual, and then in that session, a lot of day. So it sounds like inconsistency.
Yeah. So
and
so this would be intended for people working with older adults, just so that they would be more informed about when you are working with an older adult. These are things to watch out for in your own behavior and your own attitudes.
Oh, I see. So the after the examples, an individual is someone who works with. Okay, I see. Yeah, just in the beginning, I couldn't understand who they stand for. Okay.
So this will be a wonderful opportunity once we get this good idea, Lou, to send it out to all of us so we can make notes with it and send it back to Hayden and Dakota. I think it's fabulous.
Thank you.
Yeah, good work, you two. It's been such a pleasure getting to know you both.
It's been great having this opportunity and learning from everything we've been doing. So it's been a real treat.
Good. Well, thank you. We need youth to address this issue because it's real. It happens at every decade, especially for women. It's definitely very important.
Okay. Well, I'll be sure to pass this on to Kera, and she'll send it along to all of you if you have any other comments to make. We're really, I mean, any constructive criticism is welcome. So thank you.
Last quick question here. Hayden, what's your
Yes.
last name for the minutes?
Resnick, R-E-S-N-I-C-K.
Okay. Thank you.
Thank you.
Okay, wow, what a great meeting so far. We are moving into the next part of our meeting. How do we as BCOA stay relevant during these? Yes.
Sorry to interrupt you. I put the order of this, and then I started to think that maybe perhaps Mark, are you there still?
To move Mark up?
I was just wondering if he's still there. If before we talk about what we're doing, do you think it might be good to have him sort of speak about kind of the city side of things?
Yes.
That way that everybody has as much information. I kind of like, after I made that kind of the order, I thought, well, that maybe it doesn't make the most sense to have that be at the very end. So what do you think? Is that okay?
Yeah,
absolutely.
Okay, all right. I don't want to step on your toes. I just thought maybe it makes more sense for him to sort of share a little bit about what's been going on at the city for everybody to have that information, if you don't mind.
Okay, go for it.
I don't mind at all. But frankly, most of the work that the city is doing that's going to be directly pertinent to the work of the BCOA is what you're already hearing about, or what Carley will talk about during her updates, because there are a number of programs in the across the city that are designed to help people out, both the rent eviction moratorium, rent support, business support, things of that sort are all taking place sort of across the spectrum to try to make sure that people who are at the most risk of losing either a place to live or a business are getting whatever support we can offer to them. And we've had a number of instances of that, such as the city has just been granted some money, federal money directed through the state and the county. We ended up with a fairly substantial chunk of it, and a lot of that's going to be distributed to help keep restaurants and other storefront types of businesses around the city open, which not only helps, maintain the life of the city, but also helps maintain incomes for people who otherwise would not have incomes. And incomes can go to pay rent, and rent goes to pay other people's rent. So keeping the economy moving to some degree is beneficial across the board. But we're also supporting the statewide eviction moratorium and things of that sort. The other things that we're focusing on, just in terms of actual city council activity, probably the biggest one is the 6 months of planning we have to do for the change in the form of government. whose primary manifestation will be the hiring of a city manager to take over the administrative duties of managing the departments of the city. And alongside that, there will be the addition of one new person to the city council. So we'll end up having 7 people total as opposed to the 6 we have right now. The other activity that's going on that's taking some of our attention is the sort of the early stages of a long, hopefully in-depth review of police policies and police procedures in the city of Beaverton in response to some of the concerns about some of the, let's just say, less well-behaved police departments in other parts of the country. We have a pretty well-behaved police department here, but at the same time, we have not necessarily probed very deeply into sort of policies in general. And I think we've been asked to do that, and we're going to be responsible about taking a look there. And then, we've got other projects going on. The municipal court is starting to reactivate a little bit, but we're down 2 judges. We're going to be hiring 2 judges, hopefully tonight. We're going to be concluding that process so that we'll have 3, which is great for us. The downtown design project, which is changes to our development code, is moving forward. And work down in the South Cooper Mountain area to implement an alternative to using drinking water for irrigation is continuing forward. We call it the Purple Pipe Program. It's been a long, slow gestation, and we're hoping to get some resolution on that tonight. So we're working on all those kinds of things at the same time that we're trying to be fully aware of what's needed to help the community manage through the COVID crisis, with the understanding that public health is the responsibility of the county and the state, not of the city. We don't do public health here. We support their efforts, but more tangentially. So our primary focus is on resources and economic support for those parts of the city that for those residents and businesses in the city that we can really help. So that's the basic overview of what we're concentrating on. And if anybody has any questions about things that we are doing or could be doing, feel free to ask.
Any questions?
This is John. A couple of things. When City of Portland started riot control with tear gas, I did a little bit of research on that, and I sent a letter to them, the city and several of the organizations like Urban League about use of tear gas in a pandemic. And I'm wondering if you would be interested in seeing that.
Yeah, feel free to send it across. I did ask our folks whether tear gas is a normal part of the day-to-day Beaverton police equipment list, and it's not. Although I understand that in a previous disturbance in Portland 2 or 3 years ago, police from several agencies around the region were called down to Portland to help out. And I understand some of the Washington County police personnel who were participating there were involved in tear gas activities. I don't know, however, whether any of those were Beaverton police. And I don't know if they were using Beaverton police supplies. So one of the kinds of things we will get into is, what equipment do we have? And under what circumstances are the police authorized to use it here in our community? So those are the kinds of questions we want to explore.
One other thing, the Portland Police is using a thing called Long Range Acoustic Device, or LRAD. And I'm on the noise committee for the American Industrial Hygiene Association. I'm trying to do a little bit of research on that. At close quarters, that can put out noise that is very, very detrimental. It was made to communicate in the military sense over long distances with people.
Excuse me, John, I'm going to interrupt you right now. And if you could email that to Mark, that would be great, since we have one more big item we need to take care of as a committee. So it's really important, but we kind of need to move on.
Sounds good.
Thank you. Appreciate it. Is that okay, Mark?
Yep, that's fine.
Thank you.
Mark, can I say something really quick? I promise it'll be really quick, Martha.
Yes.
So in my industry and in my job, we're going to be testing monthly, COVID testing I'm talking about. Is there any thought for public testing and how that's being paid for? Is that kind of a conversation that's happening right now?
Well, the city does not receive materials or funding to support direct testing by city personnel. It's all being handled through the county health department and through the state health department. So if you want to know what resources are available, those are the folks you need to reach out to.
I'm curious.
Good.
Thank you.
Okay, so Carley, do you want to do Europe? Oh, she's busy. Okay, so we're going to move on to figuring out how do we as a committee, oh, here she comes. There's Gemma Ray. How do we stay relevant as our committee in COVID-19 times? We're not meeting physically. We're pretty much staying at home. We still have needs in the community. We do have Washington County to relate with, but what are some ideas that people have in terms of how we can continue being supportive to people and each other?
I think we need to have a presence on the publication Our City. I just got that newsletter the other day, and I looked and there was nothing in there from our committee. I did see one from the Bicycle Advisory Committee, but it looked like the information in it was outdated.
Okay, great. To have a presence on Our City.
Martha?
Guy.
Hi. One thing, like I have to say, I'm so impressed at you conducting the meeting because right as Mark was talking, I was thinking how, oh, we should hear from Carley since there's apparently stuff going on in Beaverton that might impact this conversation. But then Carley was going out of her way to distract us with that sweet little baby. A question I have is, especially since I know so many of our members are volunteers in the community, especially when it comes to schools with the AVID program, et cetera. With the upcoming changes in the Beaverton School District, has there been anything sent out to current volunteers for Beaverton School District or something within the city to have help, kind of like how the AVID program will help people? Just because I know a lot of parents are stressed over kids being home, distance learning, not getting comprehensive information on specific topics. So like John, I know, same with you, Martha, you guys are both huge volunteers. I just wonder if anything has been brought up with that, and if not, is that something that's already being enacted in our city?
Wonderful. Can we move on and get other ideas so we
very quick, yes. There's one email that came out on AVID, and it's going to be online mostly in the fall.
And so is Aspire.
So I'm sorry, Martha, my question, I don't think I formed it well, but it was pertinent to this discussion in the way that I'm wondering if that's not already enacted, if there's any way our committee can reach out to community members like yourself or others in our group to get online assistance, like do a Zoom call if you have an engineering student with an engineer who's retired and maybe not working.
Okay. The guidelines for, I'm not sure how to handle this, but the guidelines for Aspire volunteers, we can do no Zoom meetings, no FaceTime meetings. Everything has to be by email or text.
That
so
makes
no face-to-face. But if people, adults, are interested in volunteering in those areas, I know who to contact for those.
Okay, that might be a great way for intergenerational interaction and to stave off depression, maybe.
Absolutely. Anybody else? Ideas for where we're going? What is our committee going to look like now? I mean, our prom is tabled. So where are we going?
Can I say something? Yeah, so I like the idea of having an informational panel still. We can do it via Zoom, something that's pertinent to like our theme, you know, keeping with that. And maybe we could send it to all the high school students, send it to, if we have a database of seniors that we send it to, distribute that Zoom link, or maybe Facebook Live. I don't know what our capabilities are of our committee. I mean, I don't think we have a Facebook page, but you know, something on the sorts of community support. And what Kara had to say, I think resonates with all of us in all of those. We know someone in our life who's a senior, even ourselves, who's dealing with COVID. So I think we could be a really good branch or bridge to just spreading that and helping them spread that information. We just need to figure out our platform. And I like the idea of being a part of the newsletter, being maybe more virtual. Those are just some ideas.
So Sophie, when you say an information panel on Zoom, and the theme you said, I'm not sure what you're referring.
So remember how one of our events was going to be, we had those 2 events planned.
Yes.
So obviously we can't do the ball. So I'm thinking if we still did the other event, we had it more connection for maybe what Kara was bringing up.
Okay.
Bridging some of these resources to our community, and being public facing about it, holding maybe a Zoom link seminar, having our panelists talk on the Zoom, kind of like we're doing right now.
Mm-hmm.
People can come in and listen and kind of bridge that gap virtually. And then also the newsletter.
Okay.
If we had a little section, we could put information that bridge that gap.
Okay.
Does that make sense?
Yes. Anybody else? Questions, ideas?
I liked what we did today because I got a lot of information from Kera. I mean, I wasn't expecting so much. And so that just shows that what Sophie is saying, that it will work. You know, if we did that, something like that, where we have a Zoom meeting and we provide that information to a wider audience who would be interested in finding out what's going on, I think that would be great. And taking the information that we received today from Kera and distributing it to any group of people that we are connected to, I think would be a very helpful thing to do, you know, because that all those phone numbers and stuff, I'm going to distribute it to my group. There is a seniors of Indian origin. I can send it out to them because I think it would be very helpful. If you have kids, maybe in the schools and stuff, it might be helpful. Any link that we have and we can distribute it, it will just make it multiply the benefit of what we are getting, and we can distribute it out. So I think that information panel is a very good idea.
Okay.
I do too. I think the best thing we can do, I mean, as the Committee on Aging in Beaverton, is to let people know what is available and how to access it and where they can call and et cetera. And I think it's great that they're having all the stuff from the county coming out as well. But I think we're the Beaverton Committee on Aging, we could do it a little differently, have people explain what these programs are doing, because words doesn't sometimes make a very big difference. If you say, well, this is what can happen for you if you call up this number and try to get some help, or if you want to help yourself, et cetera, et cetera. I think I agree with that. I think the best way is to keep in as much communication as we possibly can in these difficult circumstances.
Okay. Sounds great. Anybody else? Ideas? Letters from home. Okay, so who wants to get together to design the informational panel on getting resources out to the public at large across the spectrum of ages? Who would like to
So are you thinking something like how people subscribe to our committee and these things will be sent to them, or are you thinking like mailers? I'm just looking for clarification.
I don't know. Sophie, what are your thoughts? Is this I mean,
I mean, it's also on Zoom, so they can access it there, but not everybody has that. So they're going to have to put together, you know, all these different things and send them around. And I'm not even sure what different things are available, but I'd be happy to be on that committee.
Okay.
Well, Suzanne, I've been on discussions where it's a Zoom meeting with board members, but it's also live broadcasted on YouTube.
Mm-hmm.
And then people can submit questions via the comment area. I mean, it might be something.
That would be a great idea. I have literally not got that much computer experience, as you well know. But I still would be happy to be a part of that because I think it's so important because people need this information. They just need it and they don't know where to get it. And it's now becoming more available, but people don't know about it. And then they're afraid. What if I call and you know, somebody, you know, so I think those are great ideas. I'd love to see that happen.
I'm pretty sure that Franziska is a veteran of doing this because back in April we did the charter information sessions exactly that way. We had a small group of panelists, but the whole thing was available to the public and it was also recorded and streamed on the web and distributed everywhere. So we know it can be done.
Mm-hmm.
Yes.
And it was
I can weigh in and say it can absolutely be done, and it can actually be done through Zoom. Zoom has the functionality to be able to live stream to YouTube, and the city of Beaverton has a YouTube page.
Oh, that would be great.
So it's a go, it sounds like. So who wants to join Suzanne to make this happen?
I want to ask one clarifying question as you do this, but like, are you also envisioning having representatives from some of these services there as part of the panel to speak to what they do and what they provide? Is that
sure?
Is that the clarification?
Sure, that's a great idea.
I mean, I think it's a great idea. I just wanted to see if that was what you were meaning.
So I think a suggestion would be something like what happened today. Like Kera came in and gave us a talk on what Washington County has available resources available for the people. Mm-hmm. If we can just filter that portion of it, right, and with a written information along with that, I think that would be very beneficial for the people at large. Mm-hmm. Instead of, you know, and have like, because this meeting while we are talking, that's not helpful for them. But from the meeting, we can pull out what's going to be important and just filter that. I haven't done it, but if somebody else has done it, but I think that would be more important, like what Kera gave, plus the written document about all the information on that meeting.
Okay. Hillary, you're muted.
I would agree with you in that. And I think that having a variety of voices with an expert panel is much more interesting than one person just talking and looking at a document. It's really boring. People are just going to zone out. Because online, you know, how much bandwidth do people have? And Francisco, you might have more information on this. How much can people handle? You know, how much can people tolerate online nowadays? Because after a while, you know, it just gets to be kind of like, okay.
And
so I don't know. I don't know.
Will actually take in any given period of time.
Right. And then the other thing is too, since we have, and then I'll stop, is the YouTube link, because then people can watch it on their own time because it's asynchronous. And so having a YouTube link is fantastic because then people can also go back and listen to the parts they want to listen to again.
Right, right.
So I have a quick question. I love this idea. Are we thinking about something that's done monthly, every couple weeks? Because we could address like the fraud aspect of fraud going on right now, mental health, like all these different components. Laura, like your resources in developing a safe home and working with vendors. I feel like this could be something that I can envision it being something done repeatedly based on, we have such a wide swath of expertise and connections in our group. So I don't know, like as far as forming a subcommittee or something, like what would it look like?
I think that's an excellent question. A suggestion that I can offer is that we can do like important segments in a monthly basis or once in 2 months, but then at the end of the year or something, have a panel of people which were like looked at by most of the people. If it was a popular idea, bring those things together and then have a panel where everybody can join in and stuff. I don't know.
So I just want to jump in here and share some of the Zoom wisdom that I have learned by trial by fire over the last couple of months. So to answer your original question, Martha, in my experience, both as somebody who takes online classes through PSU and has sat through live lectures, and has also done a handful of trainings through Zoom, one for volunteer management. That was 2 half-day trainings. I would say that the length of time that people can really, that's most tolerable for participating in a Zoom thing is probably 1.5 hours max. Typically an hour, I would say, is ideal. And so if there's a way that you can break it up so that if there's segments, you know, it's an hour and maybe there's a break and then maybe another hour sometime later, I definitely recommend that. People do get Zoom fatigue. And then the other thing that I wanted to just make you all aware of that you might not know about Zoom is that Zoom actually has the capacity to do something really, really cool called Breakout Rooms. Yes. So there's the possibility to do the broadcasting to YouTube Live, but if you wanted to do something where folks could really kind of dive into different issues in a more intimate way, it's a way to keep it engaging. And so we have that functionality through our Zoom account to create breakout rooms. So you can assign like 6 people, you know, if you have like 20 people, you know, a handful of people in this breakout room, a handful of people in this breakout room, but then they actually get to have really meaningful conversations about the topic matter that you're discussing. And that also, that's what happens in my online class, and that at least helps to break up the kind of monotony of just sitting and staring at a screen, is if you can have that more dynamic interaction. So I just wanted to throw that out there in your considerations for what's possible, that breakout rooms are also a really cool thing.
That's great.
Thank you.
I love that idea.
So I have a question. Would this format be something that would be interesting for past presenters of ours? So like Lou's friend that he worked with that talked about financial health, like would it be worthwhile to tap into these things that we were all blown away by and just kind of reintroduce it in a way where maybe we reach more people? Or Lou, again, your fraud event, like I still think about those 3 presenters and how much I gleaned from it, especially with people being so isolated. Is that an option to like tap into previous presenters of ours or events we've had?
We could do it all different kinds of ways. It sounds as though we have, depending upon what we're trying to present, we have the option of the breakout rooms, or we have the option of doing a whole hour from several people on one point. We have a lot of options, it sounds like. Although it doesn't seem like it, does it? but we do. And so, you know, I mean, the people need the information is the thing. They really manage not to get it so often. And that's what I find so much, you know. Did you know about such and such? Did you know you can call? No.
Right. So, Sophie?
They hadn't heard of it. They didn't know it.
Sophie?
Yeah, just a quick response. I've done a lot of Zoom hosting of my own, and I think what's really important is that it's current information. So bringing old speakers back would be really awesome, but I think we need to really make sure that it's a topic that is current,
yeah.
People will be a part of, and I think fraud, of course, is one of them. That's great. So that's just one comment I want to make. And then also, I'm thinking about a series, something that would kind of glean the audience to want to follow and continue to listen. I know people really, they can just still jump into the series. You know, we're not like totally disclosing everything all at once, but yet kind of keeping people engaged, I think would be really awesome. And then I'm hoping this could be something that would be monthly. So we would do maybe like our meeting, and then we would follow up in a couple weeks with a part of our series group meeting.
And it would be all different people,
And-
you know, doing what they do. Yeah.
And when you're talking about a series, a topic for the month of August, a topic for the month of September, so that kind of series.
Yeah, however we wanted to, you know, umbrella that topic. It could be as simple as support, you know, during the pandemic. That's really boring, but
It's not simple either. It's really
Can
hard.
so
But
it
it's
sounds
current.
We have
You know,
some
that-
great ideas. We need to move along because we're coming.
I need to say something about this too.
Okay.
The thing that's going to break this COVID-19 pandemic is a vaccination. And we need to think about how we reach the elderly population to get them vaccinated once one is available. And hopefully that'll be early next year, but maybe even towards the end of next year or beyond. But there needs to be a coordinated effort to get people vaccinated in order to break this thing.
Well, it can be part of our monthly things that we're doing or whatever we end up doing.
Once it's available.
Yeah. And, you know, there's going to be a lot of, you know, there's going to be a lot of issues around that, but that's okay. We could still present it. Now it's available. Everybody should get it kind of information.
I hate to cut off, but we still need to hear from Carley on the update from the city. So Carley, you're up.
Quick here, let me pull it up on my, so just a couple of things. One of the major topics has been Black Lives Matter, as you are all aware of the news of that. And so the city is really focused on the DEI, the Diversity, Equity, and Inclusion Plan. And I have an intern here beside me. She's piping up. And the city council passed a resolution denouncing systemic racism on the June 9th city council meeting. And this resolution announces the city's promise to support nonviolent protests and dismantle longstanding actions that harm people of color, as well as a commitment to eliminate racism in city structures and practices. The mayor, and I'm reading this, so I'm not seeing you all while I'm reading this. The mayor signed my brother's Keeper Alliance pledge, which was something led by former President Obama. And this is a commitment to review city policies, seek community input, and communicate the findings around the police policies. And that's a little bit something that Mark was referring to. So there's some sessions planned around that. And some logistical things, city buildings. We just got the most recent notice that city buildings are still closed and will be closed into August. And let's see here. The library has some services now, though. You can call ahead and do curbside pickup. And the court is beginning some in-person visits sooner with some safeguards in place. Let's see, with limited capacity. So those are kinds of things. And then some things are available on a program by program basis. So certain things can be by appointment, but otherwise the buildings are still closed. Okay. So that's the quick update. I'll send it to you, Hillary, so you can include it if people want to read it in more detail.
Perfect. So it looks like Sophie, Suzanne, and myself should get together to talk about the panel and anybody else who would like to join us, please email me and we will get together, okay?
And I think that we need to do that as a subcommittee meeting, which is totally fine. It's not a big deal, but we will be following the same process of just posting that we're hosting it so that if a person from the public wanted to join, they could. No big deal. And so just include me in that messaging for our scheduling purposes.
Okay. Okay. Well, I want to thank you all for being here and sharing all your great ideas, and just wash your hands, watch your physical distancing, and wear your mask when you're in enclosed spaces and you cannot separate more than 6 feet from someone else. So have a great rest of your week, and we'll be in touch for the panel idea.
Martha, amazing first meeting. Thank you.
Just one last thing. Hen Trung sent me his new newsletter for
Oh,
Hope,
wow. The Hope
and
Quarterly.
they are off the ground. They are doing work. So I thought I'd show this to you.
Awesome. Awesome.
For
Okay.
those that are new, he was one of our speakers, and they're providing services to elders, honoring our precious elders.
Yes. So wonderful.
Very cool.
Well, enjoy your lives. Be grateful and helpful to others, and take care of yourselves. Self-kindness. Be kind. Go, Laura. Bye.
Bye, everyone.
Bye-bye.
Thank you.